Hello friends, welcome to Acharya 90 FM. We are having a Hello Doctor segment. So I welcome Dr. Bhumika Gupta to our Acharya 90 FM studio. Welcome ma'am.
Hi, welcome. Pleasure to be here.
Yeah, ma'am has practiced over 10 years and she runs a clinic, Smitham Dental Care in Chembur itself. So and she has many other activities also. She is a Bharatanatyam dancer also, and she has her own desert alternative she's serving with that also. So first we'll know about her dentistry, how she got the knowledge and all. So from where you pursued dentistry?
So I graduated from Yerla Dental College, Kharghar. That was about 10 years back.
Okay.
So I've been working since then, and I've recently opened my own clinic called Smitham Dental Care right in Chembur, Main Street, Diamond Garden, opposite Diamond Garden. Yeah.
Okay. So how was your 10 years of experience of dentistry?
It was amazing. So I've seen all kinds of people right from the age of 3 months, like kids as young as 3 months who have teeth which are hurting them, right from patients over 100 years old. There have been a wide variety of patients with different kind of problems. Now, problems in dentistry are not only related to the teeth. For example, I have sorted people with back issues. I have sorted people with severe headaches, neck aches, their heels throbbing just because there were some discrepancies in their bite. Their teeth weren't aligned properly. So basically, teeth itself is not a separate entity. It is connected to the rest of your body. So only if you can sort that well, you will also solve many other issues related to your body.
And teeth plays a main important role as it comes to face. When you see a person, first thing you notice is the teeth. So they have to be aligned properly. And as you said, kids, they have a problem, dentistry problem. Then youngsters, they do have a dentistry problems, and the senior citizens also.
Correct.
So now in this today's situation, what are the kids facing problems of dentistry?
So most of the time, what I have noticed recently is most of the kids right now, the parents are really busy. Most of the parents are working. They don't spend enough time with their kids. They're often left with their nannies or their household help, or even with older parents who are not sometimes very well educated on how to be really vigilant and careful while cleaning their children's teeth. For example, if they have a snack, they'll either have a snack while watching TV, so that food will be lodged in as a pocket for a very long amount of time. The longer the food stays in your mouth, the more the bacteria attack, the more the decay. So there is not much knowledge, I feel, as with respect to hygiene, especially, for example, if you eat something, the moment you eat even a biscuit, for example, just go and gargle immediately. Don't let that food remain in your mouth for long. For example, if you have milk in the night while sleeping, have your milk, but then wash your mouth. Even if you're too tired for brushing, just maybe have a glass of water so that milk doesn't remain in your mouth, and then go to sleep. Little things, but then they go a long way. And most of the parents don't even realize that there's cavities in the mouth. So unless it becomes really bad and it turns into a root canal or something painful. So even if you see something small, even if it's like a black discoloration or something, just immediately just go and get it checked. The smaller it is, the faster it's nipped in the bud, and it's easier for the child, because I feel nowadays childhood trauma plays a very important role. For example, if they haven't had a pleasant dentist experience, the trauma stays lifelong. I have faced so many difficulties with so many adult patients who haven't had a good experience earlier. Now they are so scared to go for dental treatment. So first I need to work on them psychologically. I need to let them calm down. I'm going to assure them that I'm not going to hurt them. I'm going to be gentle. And always in my clinic, the patient is the boss. So they tell, okay, we have had enough for today. We listen to them.
Okay.
So they decide how long the treatment will be. I know what to do, but we do it as per how comfortable they are.
But how, because getting children to dentist clinic is very difficult, because they are not ready to. They see the doctor's plate, they run away. Literally, I've seen cases like that. So they don't they don't get attached to the doctors.
Correct.
So how you bring children to your?
So the first thing is, I never wear a white coat. So this is something called as white coat syndrome. The children associate white coats with people who are scary. So especially when kids come, I try not to wear my scrubs. I try to be in normal clothes. One. Secondly, the moment a child enters, we don't directly take them to the dental chair. I first try to make them comfortable. For example, I already ask their parent beforehand only what interests them, what do they like, what they don't like. For example, a child came to me that day and his mother said he loves playing with cars.
Oh.
So I got 2 cars and we were doing racing.
Acha.
So, and we just did that. Then I showed him my operatory. I showed them what instruments are there. I let them play with it. I checked their parents' teeth in front of them so they know that I'm not harming the parent. The parent is comfortable with me.
Yeah.
I made them check my teeth. And then gradually they let me put instruments in their mouth. They see that nothing is going to hurt them. I'm just going to see what is going to happen. So that's why I always advise, whenever parents go for dental treatment, take their children along. Let their child see that the parent is comfortable. The parent is happy, you know. They're well taken care of, because the child idealizes the parent as the first thing. Everything, sab kuch. I mean, yeah. So this is something called as modeling, where the child sees the parent comfortable and then they get comfortable gradually. But again, we need to be really patient with them. Can't force children, can't let them cry, can't physically restrain them.
Yeah.
You need to listen to them. As I said, they are the boss. You just have to follow.
Yeah. And what habits the children should have to have good teeth?
Basically, gargle after everything and anything you eat. Even if you by chance don't, like for example, children under 3 are not well versed with gargling. Maybe the parent can take a clean muslin cloth or something and just wipe their teeth or wipe their gums. I feel every parent should supervise their child's brushing at least until the age of 7, because the children are not very well versed, you know, with brushing. They're too small to understand. So, you know, brushing should be like a routine. For example, my child and I, we both brush together in the night. So for example, sometimes I tell her, you know, Mahi, my brush is not reaching here, can you help me with it? So she takes the toothbrush and helps me brush my teeth. So then I'm like, can I do the same for you? So then she allows me to take her brush and maybe try to brush her teeth as well. So, you know, you need to make it like a fun game, like an activity, not something intimidating, something that interests them. Yeah,
definitely. We'll take a short break here and then we'll continue our podcast with Bhumika Gupta. In today's Hello Doctor segment, we are having Dr. Bhumika Gupta with us. We'll take a short break. Keep listening, Acharya 90 FM.
Acharya 90 FM, 90 FM.
Welcome after the short break. You're listening Acharya 90 FM, your own radio. Today we are having in Hello Doctor segment Dr. Bhumika Gupta. Ma'am, after from kids, now we'll switch on to adults.
Sure.
So what are their difficulties facing doctor?
So the adults, I feel, especially everyone in India, everyone is overworked. Nobody has time for anything. But one thing I would suggest is make time for yourself first, because if you're not okay, you can't work, you can't take care of your children, you can't take care of your home. So for example, if they see something irritating them, for example, it will start with small sensitivity initially, or some kind of food getting stuck somewhere, just immediately go and get it checked. If it is small, it will be a small filling or something which is much more treatable easily. Don't let it become a root canal, or don't let it become an extraction. The more it delays, the more expensive it gets, the more time consuming it gets. So you'll just be stuck in the vicious circle. The smaller it is, try to get it checked and just nip it in the bud. Preferably go for checkups every 6 months. Kuch nahi to just go and say hi and bye to your dentist. You know, the children also then get used to the pattern, and then you also ensure that everything is all okay.
And we are having, most of the times we are consuming junk foods, or we are having difficult
a lot of
sessions,
sugar, a lot of processed food, a lot of preservatives. Try to stick to home cooked food, but I understand in like our scenario it's difficult. But even if you eat junk, ensure that it's portion controlled. Maybe you can rinse after whatever you eat. I always suggest my patients to keep a mouthwash in their office. So for example, if they consume anything which is a little too stinky or smelly, like something containing garlic or onion, even if you don't get the time to brush, just use a mouthwash and come back. So after your afternoon meal, where you will obviously be at work, just carry that small pocket mouthwash with you, so that, you know, you're just ensuring your hygiene is sorted there. And I also notice nowadays people are so, like, their life is so hectic that they consume a lot of tea and coffee, and it has a lot of sugar. And what happens is, I'm okay with tea and coffee, but you know, if you can just have a sip of water after consuming tea or coffee, so that the stains don't remain in your teeth, even if you don't have time to go to the washroom, that would be of great help.
Now we'll talk about senior citizens. What are their difficulties?
So senior citizens, the few people who have been careful all around their life, so they really have a good set of teeth which they can maintain. Most of the people I encounter really don't have good teeth. They don't have good bone levels. The main struggle I still see is, अरे मैं बाहर जा रही हूँ, मुझे दांत चाहिए.
हाँ.
But I feel पहले तुम अच्छे से खाओ तो सही ना, दांत तो मैं दे दूंगी. But the most important function of your teeth is eating. It's chewing your food so that you can be healthy. Cosmetic obviously is important. I understand looks are really important, but first basically you need to eat. So it's more of a holistic thing. The more you try to, like for example, if I give a good set of dentures or if I give some good implants and some good crowns, but the first important agenda that you should have is function. You should be able to eat well. Once you eat well, obviously you look good.
Yeah.
So yeah, it'll all fall in line.
But the senior citizens, they have much time, but they don't have people to look after them. So
That
how?
is true.
Yeah.
So again, the same pattern follows. For example, if senior citizens are wearing dentures, please remove them in the night when you go to sleep. How you have taken care of your own teeth, you need to take care of your dentures. You need to ensure they are clean. They do not stink of the food that you've eaten earlier. And nowadays I feel even though there's help and everything, you have to take care of yourself. Or at least when they go to the dentist, I would recommend the help who takes care of them day in and day out should come with them. So at least we dentists can educate the help very well. कि अगर वो नहीं कर सकते, आप कीजिए ये सब, so that he doesn't have to face the problem. So at least he can eat well and take care of his oral hygiene better. That would be really nice.
Yeah.
Someone does it. Even if he can't do it, someone should do it. Yeah.
Do you arrange some awareness campaigning? Do you do in?
Yeah, we do. Yeah, we do kids camps. We do. We also tie up with various NGOs. Recently, we'll also be conducting a camp for Ahobila Mutt, which will be happening, I think, next weekend.
Okay.
So awareness camps are very good because at least you get your teeth checked. And then whichever dentist you're comfortable with, you go, but just get it done. The main thing is getting the work done at the earliest, so that you don't.
As we have blood donation camps,
correct.
Dentist is also
dental
very
camps
important.
also there. They are there in every school. You can tie up with any NGO. My clinic will be more than happy to conduct camps. That's always a win-win. Yeah.
What are the machinery developed in recent years?
There is a lot of development. See, I feel any field you have to be constantly updated. So me as a dentist, although I have a 10-year experience, I think learning for me will continue till my last breath.
Yeah.
You have to keep learning. You have to keep updating. Earlier we used to use silver amalgam or silver fillings.
Yeah.
We used to have a lot of metal crowns. Now we have opted for many metal-free options. We have opted for more tooth-colored restorations. Earlier we used to take a lot of physical impressions to record our teeth for crowns, etc. Now we have scanners there. So we can avoid patients who have a lot of gag problem, who tend to vomit when something is there in their mouth. So everything is much more comfortable. We try to use the dental laser a lot more. So upgradation is a constant now. That is constantly happening. Yeah.
What are the other diseases? Like we have diabetes, we have hypertension, we have acidity. So does it affect our teeth?
Definitely. Like for example, people who are diabetic, their wound healing is delayed. People with blood pressure, for example, people who are on blood thinners and all, they might bleed for slightly prolonged period of time. So I would ensure that either they consult their physician or their cardiologist before coming to us if they are stopping their blood thinners, and if they are not, I ensure that at least their bleeding has completely stopped before they leave our operatory. And obviously there's a constant recall that is happening. For example, if I check a patient today evening also, in case if an extensive surgery has happened, we'll call and ask how are you doing. The next day itself again there'll be a reminder call, like how are you, and 1 week ke baad there'll be a recall visit. So constant recalls are a given for any person who's medically compromised. But all of this definitely has an impact on your teeth. For example, people with severe acidity, if you see their teeth are completely worn out. Yeah, they are very sensitive. Their teeth are much more smaller than other normal teeth because acid has destroyed their tooth structure. So you need, so ऐसा नहीं कि दांत separate part है, सब कुछ साथ में system में connected है. You have to take care of one thing so that the other thing is also, kept in check. Yeah.
And most of the people are alcoholic nowadays because of the stress and whatever the reasons will be. So how the person can protect their teeth if they are alcoholic?
If they are alcoholic, again, for example, I am okay with alcohol as long as you also supplement it with a meal. For example, if you are going for a drink party, ensure you have a snack before, like just splurging on alcohol. So you are a little well fed, you're not dehydrated. And especially after consuming alcohol, if you don't have access to washroom, just have a glass of water. That alcohol, that harsh content doesn't remain in your teeth for a long period of time. It doesn't erode your teeth for a long period of time. So if you can do that, even the small bits can take you a long way.
Mhm. And weekends is okay, but we have events also to attend and all.
Correct.
So that time, how the proportion should be of consuming alcohol?
See, it also depends on how much your body can handle. I'm okay with alcohol. The major damage will happen to your liver. I mean,
Yeah.
obviously. But along with alcohol, if you're just done with it, if you can constantly sip water, like for example, that alcohol, the harshness of the alcohol doesn't remain stuck to your tooth enamel for a very long time. So if you've had alcohol, don't have it neat. Maybe if you can dilute it with water, the better. Less percentage of the alcohol will be touching your teeth. So hydration, and if you can dilute it, would be great. Yeah.
Now I would like to ask about your Smitham Dental Care. How exactly you provide services to your patients?
So we are very centrally located, and my timings are, we start early. We start at about 8:30 and we shut by about 4:35.
Okay.
And in the evening, if someone wants to come, they can come in by appointment. So I have kept my timings a little off, you see. Like today I started my day early. We started at 7:30.
Oh.
So because I think the major difficulties faced by corporates or people who are working extensively, their hours are long. They don't get the time. So I prefer them coming to me before going to work.
Okay.
So you come to me, get your treatment done, and then you go wherever you want. Because once they come, they are tired, and it's crazy.
They're exhausted. Yeah.
They're exhausted. Yeah. So we at Smitham provide all kind of services. There is basic cleaning. There is root canals, fillings, bleaching, dentures, implants, everything. We have everything what a general dentist provides. Also, we have a more holistic treatment. Like for example, I told you I've solved people with headaches. Headaches could be related to teeth. Back issues could be related to teeth. If you don't have a well-aligned teeth system, you don't have, your teeth are not well aligned, or for example you have certain caps which have been given ages ago in the olden style and they are too tall. For example, you'll be constantly rubbing on that interference. For example, if you constantly take one weight and you just keep working your right hand, the muscle will build up. Similarly, aapka dant ka, jaw ka muscle also build up. To compensate that, the other side of your neck takes the wrath of it. Yeah. Then your back. So it goes in a crisscross fashion. Then ultimately you start getting aches all over just because of one tall crown. So we solve everything. And our timings are quite favorable for people who can actually make it. Yeah. So 8:30 to 4 I think works really well.
Yes, sir.
Yeah.
Okay. And do you have any experience of satisfactory patients? They are
so many.
Yeah.
Many. You can check our Google reviews.
Okay.
I also put up a lot of educational videos on my Instagram page where there are also feedbacks given by many of my patients. So you can definitely check that out. Yeah, but there, touch wood, there's कोई ऐसा एकदम नाराज होके नहीं गया है. It's been 10 years. Yeah, everyone's happy.
Yeah. And now I'll again take a small break and we'll move on to your Bharatnatyam and other endeavors. Yeah. So friends, keep listening Acharya 90 FM. In today's Hello Doctor segment, we are listening to Dr. Bhumika Gupta.
Acharya 90 FM 90 FM.
Welcome after the short break. You're listening to Acharya 90 FM, your old radio. We are having Bhumika Gupta today in our Hello Doctor segment. Ma'am, now I would like to know you're learning Bharatnatyam. I think last 15 years you've been trained.
I have been trained in Bharatnatyam. I started Bharatnatyam when I was 3 years old and continued that with a lot of breaks. But I did Bharatnatyam. Then I also graduated to teaching Zumba and Pilates. I taught for about 6 years until I got my child, and then I got fully busy in dentistry. Yeah. So that's been an unending passion, yes.
Okay, but how you manage both your clinic and your passion?
So I try to do it over the weekends, is mostly when I get time, or sometimes early morning before going to work. It depends as and when, because that's something which gives me a lot of happiness. I also alternatively try to do some kind of physical fitness to keep me happy, because that is something makes me mentally sane. Ironically, the physical fitness keeps me mentally sane. Yeah, so any kind, even a short workout like maybe a run or a small gym session, whatever. So I try to do that before I go to work, so that I'm in a very happy space of mind when I get to work. Yeah.
And at the age of 11 you have completed Arangetram.
Yeah,
That's
I did
a
my
great
Arangetram, yes.
Great achievement. And now you have even a Nani's pantry, right?
Yeah.
Yeah. What is that?
So Nani's Pantry was started by my mom. She's basically a baker. And it started when my child was born, and I used to celebrate every milestone of my child. So we used to have monthly birthdays and stuff, and I was very hesitant to give her outside cakes because they have a lot of sugar, preservatives and stuff. So my mom has been baking for me since I was a child. So she used to use alternatives to wheat like jawar, rajgira, and sweeten it with dates or jaggery. So we started giving her those cakes, and seeing that a few of her friends started ordering. So then we thought we'll convert it into a small business where she bakes cakes and everything is made fresh. So for example, if we place an order for tomorrow, it will be made fresh on the day of delivery. So that's why we can cater to a very small scale. But definitely we have a wide variety of options. We have healthy cakes, we have healthy cookies, we have makhana, we have healthy mithai. All of this is without wheat, without egg, without any kind of preservative. So that's why whatever you buy has to be consumed within 2-3 days. Except our cookies or laddus or pinnies, they last over a month. So again, there's a healthier alternative to everything. So the baking is mainly done by mom, and the marketing is what I do. And on the cover page, if you see, it's my mother and my child, and that is actually it's a illustration of a real picture where they both are happily cutting a cake. So we have just taken that same image and doodled it on the packaging of each box. We just want to show that everything homemade is much better than anything packaged, and it has a direct bearing to my dentistry as well, because I would really avoid something which has so much preservative and so much artificial sweeteners, sugar, and opt for something homemade. That would be much better.
Now, for end of the interview, what you would like to give something some deliver to your patients or our listeners?
So I would just say time is money, literally, in dentistry. Do not wait. If you have a small problem, just nip it in the bud. Just go to a dentist, get it checked. The smaller it is, the easier and cheaper, on your pocket as well for it to handle. After everything and anything you eat, please gargle. Try to maintain a clean hygiene. Go for 6 monthly checkups. Your health is everything. If you take care of yourself, you'll be able to take care of everything around you. So prioritize yourself first. Every time you go for any kind of dental visit, take your child for a small amount of time. Let them see that you're comfortable. Let them see you're happy. So that, God forbid, if they get something big, they are not scared, and it's not an alien environment for them. They are comfortable and at home already. It makes it easier for you. It makes it easier for the dentist and the child.
Yeah, this was your message for your general listeners. But if some students want to pursue dentistry, so what advice you would like to give them?
So I would suggest, don't think that 5 years of dentistry and maybe if you want to do postgrad, 3 years of postgrad is everything, it's done. Learning is going to be never ending. You have to learn with each and every patient. You have to learn the little things, like how you can talk to a patient, like how can you treat a patient. The first thing is you need to make them comfortable. You need to make them understand that they're going to be okay. And then comes obviously the skill mastery. But the skill mastery is going to take time. It's not that, 5 साल किया और सब कुछ आ गया. No, it's going to take time, but don't be disheartened. It's a never-ending journey, but it is so fruitful the moment you see a happy smile or a person who has been relieved of pain. Because dental pain can be worse than childbirth. Okay, it can get really bad. But once you see the patient is happy and satisfied, all your worries are like, okay, I'm happy. That's like the best part of your day. So it's a lovely profession. You can choose your timings. No one is going to come with really, there are not going to be any major disadvantages of this profession. It's really nice. I would definitely recommend you to pursue it.
Thank you. Nice talking with you, and thank you for joining us on Acharya 90 FM.
Thank you.
So friends, today we had in Hello Doctor segment Dr. Bhumika Gupta with us. We'll join with other doctors in next Hello Doctor segment. Till then, keep listening. Acharya 90 FM, your own radio. Thank you.
Acharya